I would like to speak about endoscopic anatomy of the lateral wall of the nose. Okay, we always start with this is the endoscopic view of the right nasal cavity. We always do a diagnostic endoscopy systematically, that is first pass, second pass and third pass. Okay, this is endoscopic view of the left nasal cavity. Diagnostic endoscopy we do. This is the first pass. This is the inferior turbinate, nasal septum, and this is the middle turbinate. Okay, and going back in the first pass, we see the nasopharynx, sphenoethmoidal recess here, and inferior part of the superior turbinate also you should be able to see. And this is the view of the nasopharynx. You can see the Rathke's pouch, and also the eustachian tube opening is there. And further view behind this depression is Rathke's pouch, and this is the eustachian tube area. Okay, a little more view of the nasopharynx, and all here the eustachian tube area in the close-up view. You can see the Rathke's pouch in a close-up view, entire nasopharynx, bilateral fossa of Rosenmuller. This is the opposite side eustachian tube using 30-degree endoscope. Okay, and this is trying to medializing the inferior turbinate to spot the Hasner's valve, where the opening of the nasolacrimal duct is there, Hasner's valve, and this is second pass into the sphenoethmoid recess first. You will be able to sometimes see the sphenoid sinus osteum and also the vessel spinopalatal branches. Okay, if you are not able to see, if you are using a 30-degree angle scope, gently rotate superiorly, you will be able to see the sphenoid sinus osteum. This is the sphenoid sinus osteum. You can see, visualize very clearly. Okay, and the third pass, the olfactory area, the danger area medial to the middle turbinate, you should be able to see. Okay, and next is third pass, view into the key area. This is the uncinate process. Okay, this is the middle, this is the ethmoid infundibulum, and this is the bulla you see. Okay, this is the retrobullar space, suprabullar space. Okay, and right side there is a concha bullosa, and this is being incised. Okay, and this is being split. Okay, and part of the concha bullosa, medial part has been removed, lateral part has been removed here, and the uncinectomy is being done. See the sickle knife is kept parallel to the uncinate process, all lamina propria. Okay, it's being incised, going to the middle part. This is the upper part of the uncinate process. Remember, superior attachment of the uncinate process, there can be three attachments. Either it can attach to the lamina propria or the skull base or the middle turbinate. Okay, so that we should know. Okay, and the uncinate process is being removed. Okay, now this is the bulla ethmoidal is ante-wall of the bulla. So bulla is being perforated. Okay, and remain lateral wall of the bulla is lamina propria. Remember here. Okay, yeah, now this is the bulla anterior wall. The bulla has been opened. Here this is the ground lamella. There is a dehiscence in the ground lamella. You should remember, here there is a dehiscence in the ground lamella. Okay, and this is horizontal part of the basal lamella or attachment of the middle turbinate. Okay, yeah, then the remaining part of the bulla, the posterior wall of the bulla is being removed. Okay, this is the posterior ethmoidal cell. Yeah, pyramidal shape of the posterior ethmoidal cells are being excised. Okay, and this is the anterior wall of the bulla, just to show you the lamella. Okay, this is the uncinate lamella attachment, this is the bulla lamella attachment. Okay, and the bulla posterior wall is being removed, and remember, always, don't remove the complete basal lamella attachments. This will destabilize the middle turbinate. Okay, yeah, the posterior ethmoids are being dissected. Yeah, posterior ethmoids being dissected, then you will see the posterior ethmoidal cell or Onodi cell. This is a pyramidal shaped cell where the apex is directed towards the medial thing, and you can see the optic nerve here. Okay, this is the optic nerve, this is the Onodi cell, and here is the optic nerve, and this is most probably posterior ethmoidal artery. Okay, and see how to enter into the sphenoid sinus. Here anterior to the posterior of the Onodi cell, a posterior ethmoidal cell, anterior inferiorly we perforate, we go into the sphenoid sinus. Understand the relationship here. See, whenever you see on a CT scan, on horizontal bony plate in the sphenoid sinus, remember, above to that is the Onodi cell and below is the sphenoid sinus. You can see here the horizontal bony septa here. This below that is the sphenoid sinus, above that is the Onodi cell. Okay, and this is the sphenoid sinus. You can see the interior. Okay, and this is the superior view here. This is the posterior ethmoidal artery. This is the middle turbinate. This is the Onodi cell. This is the sphenoid sinus. This is the lamina propria. Okay, lamina propria showing one more view. Okay, posterior ethmoidal nerve and artery being shown here. Okay, yeah, this is recessus terminalis. See, in this, this is the superior attachment of the uncinate process. It is attaching to the lamina propria. Okay, and when it's attached like that, there is a narrow cul-de-sac space. This we call it as recessus terminalis. Okay, yeah, the recessus terminalis. This is being removed. Okay, yeah, recessus terminalis being removed. Once you remove that, then what you see is, you see the agar nasal cell anti-ethmoidal, most anti-ethmoidal cells. This is a superior supraorbital pneumatization. Okay, and this is the agar nasal cell, and once you open that like a eggshell opening, a Stamberger's technique, what you see is the frontal recess. Remember the boundaries of the frontal recess. Medially we have the middle turbinate, laterally we have the lamina propria, and anteriorly is the anti-wall of the posterior wall of the agar nasal cell, and posteriorly this is the ethmoid crest. We have anti-wall of the bulla. You should remember the dimensions, and this is the frontal recess, agar nasal, and this is anti-wall of the bulla. Okay, or ethmoid crest. Okay, and the types of the frontal cells, you should remember Frederick Kuhn cells. We will go to that further. Okay, yeah, this is the frontal sinus, view into the frontal sinus. Next what we see is maxillary sinus osteum. Okay, maxillary sinus osteum and how to do middle meatal antrostomy. Yesterday I showed at the expense of the posterior frontanale. So what you do, you can use a probe or a scissor, and you cut the posterior frontanale, and you reflect that part medially, and then you can remove using a true cutting forceps, and that will give you interior view of the maxillary sinus. Okay, any pathology you can dissect. Okay, and this is anti-ethmoidal artery. I told you this is supraethmoidal supraorbital pneumatization. This is the ethmoid crest. Okay, 2 mm behind is the anti-ethmoidal artery. Okay, so you should remember this anatomy very well. You should do more dissections. Okay, with that you will be able to do a endoscopic sinus surgery effectively. Yeah.